Welcome to this brand new episode of DadTalks powered by Duccini. I'm wearing their shoes and they're really comfortable, and you must check them out at Shoemart at Center Point stores across the UAE, and you can shop them online as well. This week on DadTalks, we've got someone who's going to talk about something which is a part of our day to day life. Without that, you can't live because it's breathing. It's about your jaw, it's about the working of it all coming together and being absolutely fine. Such an honor to have you in the studios, Dr. Rashida. How are you doing?
I'm doing good, and thank you for having me again.
Thank you very much for coming again. It's wonderful to have you. And I know that last time we spoke about a few things, but we left quite a few untouched when it comes to the topics, and especially when it comes to parents and when it comes to the kids. This is quite important. We'll deep dive into it straight away. Let's talk about mouth breathing, what exactly it is, and top three things that parents should look out for when they are trying to analyze their child at home with that.
That's right. So, the correct way of breathing is nasal breathing through your nose. But if you're not breathing from your nose, you're breathing from your mouth, which is a very incorrect way. Why? Because your nose humidifies, filters, and warms your air. Okay. Also, your nose has a very powerful molecule called nitric oxide, which is responsible for carrying the oxygen to all your tissues, which your mouth does not have. So, when you're breathing from your mouth, you're actually taking a lot of unnecessary, unfiltered air, which could possibly lead into a lot of infections and allergic rhinitis and all of that. So also mouth breathing could lead to a variety of other health disorders like long narrow face, your tongue being low in your mouth, which could be responsible for the narrow jaws and which could lead to sleep apnea later on in life. So few things to look out for is if your child is breathing from his mouth at night, or if the child is snoring or clenching his teeth, or when the child is waking up, maybe feeling very hyperactive or tired or fatigued during the day, or having symptoms of ADHD. So these are not normal, and this could be associated with something called as sleep breathing disorder in kids.
Okay, when you're talking about child, could you put an age bracket to it? From which age to which age?
Could be from any age, right from like being just born babies to they are 10 to 11 year old.
Okay.
So if the child is breathing from his mouth during day, particularly during sleep, it's not normal. It's a very big red flag and something to look out for.
Okay, we now know the symptoms of it. Are there any ways to cure it?
The best way is to see an airway dentist, to evaluate what is the root cause behind that. Sometimes it could be because of something called as tongue tie or low tongue posture, or some congestion in the nose, nasal deviation, nasal polyps, sinus polyps. So there could be a lot of possibilities that why is the child breathing from the mouth. So first you need to address the root cause, and there are so many treatment that's possible these days, like for example, expansion of the jaws, or doing something called as myofunctional therapy. Or just showing to an ENT if there is let's say a nasal blockage.
Okay, so then once you figure out the root cause, then there is a cure to it, which is quite amazing. That means it's curable.
Absolutely.
Okay, now let's talk about, we were discussing this off air, where we were talking about, if you hear a click in your jaw while opening your mouth and while closing your mouth, is it always a symptom of this, which is called TMD, if I'm not mistaken?
That's right. So first, let me tell you, Tarun, what is TMD and what is TMJ? TMJ is a temporomandibular joint. We all have that, okay? These are two joints present on either side of your midline, which is connected to your lower jaw, okay? And this connects to your skull. Now, when there's a dysfunction in this joint, you call a temporomandibular joint dysfunction, or TMD. Most often, TMD is an umbrella term, which actually has a lot of symptoms, including headache, migraine, body ache, tingling sensation in the fingers. Why? Because, everything in your body is connected to each other. So if one joint in your body is not functioning properly, it could have an impact on the other part of the body as well. So this is what we as a neuromuscular dentist look into. If your jaw is misaligned, if your teeth is not aligned, your muscles also may not be in harmony with each other, and so is your nervous system. So neuromuscular dentistry is a field of dentistry that looks into treating the misalignment of your jaw, misalignment of your teeth, and muscle imbalance.
And when it comes to neuromuscular dentistry, what I have heard is you're the pioneer in the UAE and you're also the president of something called ICMO.
That's right.
So what is ICMO?
ICMO is an International College of Craniomandibular Orthopedic, and I'm fortunate enough to be the president of ICMO Middle East.
So well done for being the flag bearer and helping so many patients around the UAE with this. When we're talking about TMD as per se, you have mentioned a few things because it's now with the neurology of a human being as well.
Yes.
What are the effects of it if it is left untreated? What can a person go through?
That's a very good question, Tarun, because a lot of patients that comes to me, they're like, "Oh, we've actually been suffering from it since last 10 years," and I'm like, "What made you come to me now?" Because they're like, the initial symptoms are just clicking and popping. So it's a human tendency that they don't want to, probably go to a doctor or any specialist till the time it doesn't hurt. But if it's clicking or popping, in itself is one of the red flag that something is not working right in your jaw joint. So in your jaw joint, we have a cushion. All your joints have a cushion, which facilitates the movement of that joint. So when that cushion, or what we call as articular disc, gets displaced from its original position, that's when it starts to click or pop. So even if it's displaced, basically it's not functioning properly. So we need to look into the root cause of why the articular disc has been displaced. And it does definitely require treatment at that stage. But if people ignore at that stage, then they already have come to a stage which is more advanced. But luckily, we now have those technologies to sort of not only identify the root cause, but also make sure we can identify what's the right place for your jaw joint, the joint alignment, your teeth alignment, and your muscle balance.
We were talking about, La Dente, which is your clinic. I believe it's in Al Wasl, correct?
That's right, yeah.
And you're talking about technology right now.
Yeah.
What kind of equipments do you have at your clinic, which now makes you one of the pioneers in the field, and also which enables the patient to come to you and get cured?
Okay. So we use very specific technologies and very meticulous technologies to identify these disorders. So something called as kinesiograph, which is a jaw tracking, which also has electromyography of the muscles, electrosonography of your jaw joint. It basically identifies the functions of your jaw movement. Also, we use something called as T-scan, which is a digital bite analysis. So what does that do is basically when you're biting, how the forces are coming along, when your teeth come together. And most of the time, these forces cannot be just seen with your naked eyes or just by using the articulating paper. Mostly, this is what dentists use. So you need certain technology to understand this, because if you do not know if the forces are imbalanced, let's say, it could actually lead to a variety of problems in your, not just jaw, in your overall body. It could lead to muscle imbalance, joint misalignment, which could lead to headache, migraine, body aches, ear problem, pain behind the eyes, even tinnitus in the ear.
What is tinnitus?
Tinnitus is a ringing of the ear.
Okay.
Yeah.
And does it also cause, back pain or?
Absolutely, yeah. I do see a lot of TMD cases with very common symptoms of upper cervical pain, which is shoulder pain, lower back pain, pain behind the eyes, pain in the ears, congestion of the ears, tinnitus, tingling sensation of fingers. So it's all related.
And it's all related to your jaw.
Absolutely.
So when it comes to this being disaligned and when it comes to oral health, are there any, relation in that as well when it comes to, people regularly brushing their teeth or kids, obviously, sometimes they are very fussy and they don't want to brush their teeth regularly. And rightfully so, because, they are still developing. But is oral health related to this as well?
So I always tell all my patients that your oral health is a mirror of your overall health. Okay? And your bite is the steering wheel of your entire posture. So if your oral health is not good, of course it can impact your overall health, but there are so many things that I can identify now being a functional dentist just by looking at your mouth. For example, let's say when kids come to me and I don't see gaps in their primary teeth, milky teeth, I now know that, okay, the jaws are not fully developed. And what could be the reason why the jaws are not probably fully developed. Maybe the tongue is not functioning properly. Maybe the child could have a tongue tie. Maybe the child is mouth breathing. So just looking at these oral signs, you could sort of diagnose a lot of problems and treat at an early stage
Before it gets
before
way too
it
out
becomes
of hand.
worse. Yes.
So, for example, there is a parent looking at this video right now and they observe that, hey, my child does not have any gaps in the teeth. What is the right age for them to bring them to you?
Right. So, see, the primary teeth, kids get it between 6 months to 5 years. I always tell my patients to look out for these signs in the kids. If your child does not have enough gaps in the primary teeth, bring them to a airway dentist or a neuromuscular dentist. If they don't, if they are snoring at night, if they are mouth breathing at night, if they are bedwetting, if they have any hyperactivity or ADHD-like syndrome, or if they are just picky eaters, So these all could be related to, sleep breathing disorder or jaw issues as well.
Okay, now talking about ADHD and talking about the relationship with TMD. I've read somewhere that a lot of screen time can also cause TMD. Is that a myth or is that a reality?
Well, I wouldn't say it's a myth, but I would say somewhere, a lot of screen time also leads to some posture problems. But technically, we again have to look into the root cause in the mouth, okay? Because what I'm seeing now is majority of the kids nowadays have a narrower jaws compared to what we used to have, like, let's say 100 years ago. And why is that so? Because our eating habits have changed. The breastfeeding habits have changed a lot, which is leading to a narrower jaw. So I see, in fact, I jokingly tell my patients that to see a properly grown jaws in the kids has become an anomaly now. It's like unicorn.
Oh, really?
Yeah.
Oh, wow. Is it majorly because of, as you mentioned, the mums are busy?
Right.
They are perhaps under stress. There are hormonal issues. They are not able to lactate for longer.
Yeah.
Is that one of the causes there?
Absolutely. Breastfeeding has been one of the biggest cause of, the jaws not being developed fully. The ideal number of years for breastfeeding is 2 years. But we are taught or we are told that, 6 months or a year is fine.
Yeah.
That's fine from probably a nutritional point of view, but from a developmental point of view, a baby needs to be fed by breast for 2 years minimum. Because the way your tongue suctions up against the palate when the child is getting breastfed is very different compared to when the child is being fed by the bottle feeding.
Okay.
And when your muscle is functioning properly, it's basically growing your jaw also optimally.
That's such a wonderful point that you brought up, and I believe to all the parents, especially the mums, it does help in the overall development for the years to come.
Absolutely.
Wow, that's quite wonderful insight into it.
Yeah. And also, our eating habits have changed a lot. We are eating a lot of softer diet compared to what, let's say, a generation 100 years ago from us used to be eating. They were eating like more real crunchy food.
Like cucumber and carrots and so on and so
absolutely.
forth. Not
Yes.
crisps and not biscuits, please.
Right.
Yeah.
So that also leads to our jaws being narrow because we are not exercising our tongue and the muscles as much as we should.
Okay. Now we'll get into the section of a podcast where we'll stick to top 3.
Okay.
Okay. So top 3 tips for parents who have been very young, like me, 1.5-year-old dad. What would be the top 3 tips for parents who are observing their child at home, especially from TMD point of view?
Okay. So first, look out for if the child is snoring at night, if the child is mouth breathing at night, and if the breastfeeding, like the child is having difficulty, getting latched, or if the mother is not able to breastfeed the kid. So these are all the symptoms to look out for.
Okay. Top 3 reasons that we should come to you. When you, like, what should we observe, or a parent should observe, now it's time to go to an airway dentist or a TMD expert.
When you're seeing child is not, again, sleeping well, having any sleep breathing disorder, snoring is not normal, clenching at night is not normal. Also, when you see kids having dark circles, kids are not supposed to have dark circles. Dark circles means, of course, the kid has not slept properly and there's a deoxygenation of the blood. That means the oxygen has not been optimum at night. So kids don't get dark circle, they get pinkish hue around the eyes. So these are the signs that you need to look for.
And as soon as you see them, just go to an expert.
Absolutely, yeah.
All right. Now, when it comes to the parents, let's talk about sleep apnea. Number one, what exactly is sleep apnea? And number two, can it be cured?
Okay. So sleep apnea means cessation of breathing. When you stop to breathe for 10 seconds or more at night. Okay. And snoring is just one of the symptom of sleep apnea. Not all snoring may or may not be sleep apnea. So how do you check that? Basically, you do a specific sleep study. Either it could be at lab, hospital, or at home. What we call as polysomnograph or home sleep test. We identify the number of apnea and hypopnea events that you have. And based on that, we tell you, okay, whether you have mild, moderate, or severe sleep apnea. Let's say your AHI score is 10. That means at least 10 times in an hour, you're stopping to breathe for 10 seconds or more.
Oh, wow. That's scary.
Yeah, that's scary. And you don't even come to know. That's the most dangerous part. Like people, sometimes they come to me and they're like, oh no, I only snore when I'm tired. And when I do their sleep study, I see their sleep apnea being like moderate or high. And I'm like, look, you don't even know that you have sleep apnea.
And what are the cures of it, if there are any cures?
Yeah, of course there are. Luckily, of course, the first part is to identify the root cause. Majority of the obstruction that happens in a oropharynx area, which is behind your tongue. So it could be because you have a low tongue posture, you have a narrow jaws or a tongue tie, or also because you may have gone for an orthodontic treatment with 4 teeth being pulled out. So, your jaws become even more narrower, it shrinks. So your tongue does not have enough space for it to rest, so it falls behind. That could also lead to sleep apnea. So once you identify the root cause, it's very easy then to treat it.
Okay. Now, when it comes to, adults, again, I'm talking about parents here. I've seen and heard that putting a, what do you call it? A grill in your face? What is it?
The mouth guard.
The mouth guard.
Yeah.
Sorry. Why would we put a grill in your face? Those are the rappers who do that. Yeah. So putting a mouth guard in your mouth does help with a lot of things, especially when it comes to the oral health.
Right.
Is it true?
Absolutely. So we make custom, I wouldn't say night guard, but these are oral appliances that can be made. So there's something called as mandibular advancement device, which is very helpful for treating mild to moderate sleep apnea. Nowadays, we also have some expansion devices, and I have been successfully treating them since 15 years. People have a myth that, beyond a certain age, your jaws cannot be developed, but that's not true. Even I have been treating people with above the age of 60 or 70 as well.
Wow.
And even at that age, we can develop the jaws.
All right.
Yeah.
And mouth guard or night guards can help with that.
Well, not really in mouth guard and night guard, but these are expanders. These are very specific expanders and appliances that looks into expanding your upper and the lower jaw. So it opens up the airway space.
Okay. Now talking about mouth guards, why was I talking about that? Because I've heard that grinding of teeth is also quite common, especially if you're stressed or when you're sleeping, you don't even know that you're doing this.
That's right.
Why would someone do that? And does mouth guard help with it? Okay. And is it a part of the entire issue with TMD?
So again, a very good question, Tarun, because this is something that's so controversial even in dentistry till date. We have been taught in dental school that grinding only happens because the person is stressed. Whereas now the research find out that majority of the grinding happens because of the compensation for airway. So when you are actually struggling to breathe at night, your jaw wants to come forward to sort of open up the airway. So whenever the person is coming to me with grinding or clenching as their chief complaint, the first thing that I ask them to do is the sleep study. And I identify if the person has a sleep breathing disorder. And based on that, we would like to correct that. And what we see is once we correct the breathing disorder, the clenching and grinding becomes better. So a lot of dentists actually just give the mouth guard, and I feel that's not the right way to treat these disorders at all. In fact, a certain night guard makes it worse.
Oh, wow.
Yeah.
So brilliant when it comes to you actually pinpointing the problem and then taking on from there to find the cure instead of just...
Right.
So please do check her out. It's Ladente, right? Am I saying it
Ladente,
right?
that's right.
Ladente.
Ladente,
And
yeah.
this is in Alwasal. Before I let you go, I have one more question to ask you, and that was again somehow somewhere related to, the oral health. A lot of people brush only once a teeth, once a day. First, according to you being an expert in what you do and talking about oral health, to all the parents, to all the kids, how many times should one brush their teeth? What should be the length of brushing their teeth? And what, according to you, is the right way of brushing the teeth?
Okay.
And should we also use a mouthwash?
Okay. So, number of times that you should be brushing your teeth, 2 times a day. A lot of people ask me, is 3 times okay? But I just feel it's too much. You don't need to. Once in the morning and once at night before sleeping. It's very, very important. What my protocol is, I of course use electronic toothbrush. And the kind of the toothpaste that I would like to recommend is something that has hydroxyapatite in it, not really fluoride. I'm not a fan of fluoride. And mouthwash, no, I don't really use mouthwash because now what we know that a lot of mouthwash has alcohol in it, which also tends to kill your good microbiome, and we don't want that. We want to have the healthy bacteria in our mouth. Thank you for having me here, Tarun.
This is a small little something from our friends at Duchini for you.
Oh, thank you. Thank you.
Please do check them out. They are at Centerpoint stores across the UAE, and it's at Shumat. Thank you so much once again for taking your time out. I'm still stuck at 10 minutes. The kaun brush karega bhai? But yeah, wonderful to have you on DadTalks. Thank you very much.
Thank you, Tarun, for having me. It was always wonderful to chat with you.
Thank you.
Thank you.
City 1016.